an official opinion from a fertility specialist. There was a study published a few years ago by Brower et al. Where they looked at women with rheumatoid arthritis. Fertility concerns have been an issue with RA, and in general, women with RA on average take longer to conceive, and the point of this study was to see why that might be. 42% of them had greater than 12 months time to pregnancy. In the general population, that number would be more like 15 to 20%. So here are the important factors: age, obvious, nulliparity, NSAID use was a significant factor in terms of prolonging the amount of time it took a woman with rheumatoid arthritis to get pregnant, and also active disease and prednisone. There had been studies that have shown, both in vivo and in vitro studies, that NSAIDs can cause luteinized unruptured follicle syndrome, which is just what it sounds like. The woman does not ovulate because the follicle does not rupture. And this small study came out recently looking at young JIA patients, and they evaluated them with ultrasounds and found that of the patients on NSAIDs, I mean, tiny numbers, but very interesting, I think, 2 out of 8 did not ovulate, had this issue, while they didn't see it in any patients with JIA not on NSAIDs, and they didn't see it in their controls. So it's something to think about. I don't think that we need to stop NSAIDs automatically, but if a patient is having trouble conceiving, I mean, you may certainly want to discuss it with her. But certainly if she's having trouble conceiving, I think it's something that's a logical next step. Okay, case number 3, 37-year-old woman with RA in active disease on methotrexate, adalimumab for a number of years.